On board with us is Dr. Joe Congeni from Sports Medicine Center at Akron Children's Hospital. Good morning, Joe. I don't know Ray. What you know, but what can you tell us about knee surgery right away on K-Love, my friend?
Well, Ray, I was listening to your show a little bit driving in this morning, and I think I want a second opinion on my on your scoreboard show. Really what I want to talk about is second opinions in sports medicine, in all of medicine, but particularly in our area of sports medicine, might be leaving some people kind of scratching their head on, what was the issue going on with Kevin Love. And, of course, I don't know all the details, and not seeing him, I know that he saw some of the Cavaliers docs, and he wound up out in New York with the well-known surgeon that fixed his shoulder, who works with the Mets and some of the New York teams. But second opinions can be very useful in sports medicine, and so they can be useful in professional athletes, but we use them a lot in high school athletes and even kids that are, in youth sports, in trying to sort some things out. So, Ray, much of the time, things are pretty straightforward in sports medicine. I'd say probably 80 to 90% of the time, especially as we get into needing to do a procedure like surgery or an injection or something like that. Most of the time, it's pretty clear-cut on these surgical procedures. A person has torn their ACL and it needs to be fixed, or a person has a torn labrum in their shoulder from dislocating their shoulder several times and it needs to be fixed. But there are times, 10, 15, 20% of the time where you might get two or three differing opinions on things. And in second opinions, a lot of times you want to take other issues into account. So the other issues in a situation like what they might have been discussing in the Kevin Love situation is, had it been a different time of the year and you have a loose body in your knee, you may give it some time with an injection or some non-operative care of medicines and physical therapy and other things like that. But in the meantime, at this time of the year, they look ahead and say they do those things, and in 4 weeks his knee is no better, it's still swollen, he can't bend it or straighten it, and then if you consider doing the surgery, he ends up missing the playoffs. So those are the kinds of factors that come into play. Same thing with some of our high school kids. A kid's a senior coming up. Are they going to want to have something done now? Are they going to want to wait for that? So there's a lot of other factors, and really the most important thing about a second opinion is reviewing what that person would do and what are the risks and benefits of doing it that way. And so we're asked a lot at sports medicine to give second opinions because, being non-surgeons, people will come to ask us an opinion and say, okay, one surgeon told me this and one surgeon told me something different, and they're looking for somebody like us. And very often in my office, Ray, I'll tell a kid, hey, here's what I would do if it was my kid who was in this situation right now, and parents will ask me those kinds of questions. But second opinions are an important part of medicine, and you just need to have informed consent. And what that means is you need to know, if we are going to go this way, here's the pluses and minuses. If we're going to go another way, here's the pluses and minuses of another course of action. And I think it's real important in our world for parents and athletes to know all the risks and benefits.
Joe, do you know anything at all about the K-Love surgery? Was it something that was torn, stretched, or are they doing cleanup? Have you heard anything at all?
I probably read about 8 to 10 articles last night before today to come in, and obviously everybody's vague. They were really vague 24 hours before that, saying nothing at all about it. But they did say that he went to New York and what surgeon he saw, and that he had a loose body in his knee. And so a loose body in the knee, Ray, is usually a loose body is a piece that comes from perhaps a smaller fracture early on, even a growth plate problem earlier on in somebody's sports career. It may have been there for weeks or months, and so that's why you didn't see any injury. If you looked back, I believe it was the Nuggets game, Ray, where he was playing. Yeah. You were seeing that game. You didn't see any big twisting injury, or he didn't come down and get helped off the court into the locker room and things. After the game, it started to swell. And from gathering what people were talking about, this could have been the kind of thing, a loose body that could have been in his knee for a long time. And like I said, had it been another time in the season, maybe you say, hey, we give it some time to settle down again now with some other forms of treatment. But anyway, all I'm reading about it, Ray, is that a loose body is usually from a previous injury.
Dr. Joe Congeni with us, Sports Medicine Center at Akron Children's Hospital. Tony brought up a point this morning, and I just wanted to ask you, before Kevin came to the Cavaliers when he was playing with Minnesota, Joe, he was stockier, and if you remember, he lost all that weight, and then he came to the Cavaliers, and we've seen him back issues, knee issues. Of course, the shoulder was it just being tugged and yanked. But losing some of that body mass, do you ever see that work with athletes where maybe it makes them more open to injury?
I definitely see that there are certain body types that athletes have, and if they try to get too far away from their body type, either trying to gain too much weight or lose too much weight, I've seen kids in my world, and not just professional athletes. You know, my world is more the high school, junior high, college athlete. Is I've seen kids trying to get away from their body weight, get into problems. But just looking in from the outside at Kevin Love, really what he's been trying to do is to add more muscle strength to avoid these kinds of injuries. And I thought in the last year or two, I think I have seen some changes like you guys have, but actually changes that are probably being directed by the medical staff trying to make him stronger to avoid these kinds of injuries. You're right. And so I think sometimes just carrying around too much weight and stocky can be can lead to injury as well. So I'd say it's very hard to draw a parallel there, but I would say, my old rule, Ray, and we talk about it a lot of Wednesdays through the course of the year, is once a person is battling one injury, they can be more prone to another. And so I think the fact that he was battling that back, he was going a couple of weeks and doing okay, and then struggling again, it's not unusual. If you remember the beginning of the year for J.R. Smith, J.R. held out, had one injury after another, and then ends up with the broken thumb. I do see that injuries kind of follow each other, and I do believe there's a little bit to that theory as well. But it is kind of frustrating, and I know it is for Kevin Love, and I think they were doing exactly the opposite, trying to make him stronger so that he was avoiding some of these injuries. And I think you've seen that a little bit with Kyrie Irving. Kyrie's playing through a lot. Kyrie's not getting those longer-term injuries, and I think it's a little bit as to what they've kind of prepared his body for.
Great stuff this morning, Joe. Thanks for the time, as always, my friend. We'll catch up with you next week.
Okay, Ray. Have a great week.
You too. Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital.